Hello, my name is Dr. Kellyn Lee. I'm a chartered psychologist and I am the founder of the Dementia Care Hub. So the Dementia Care Hub, it exists because I became really frustrated with the lack of support that families who are living with dementia receive. I spent over a decade in research, trying to improve services through evidence to show, what people need, when they need it, how they need it. But I didn't really see it being implemented in practice. So I decided that if I can't rely on other people to do that, then I'll do it myself. So I set up the Dementia Care Hub. We established our first group in December 2021 at Totton and Ealing Community Centre. We had an overwhelming response. It really does show just how much it is needed. We have local volunteers, we have local members of staff employed. We do everything based on community. We are a community-focused charity. So what do we do and why do we do it? So in terms of dementia, it is typical that somebody will get that terminal diagnosis, walk out of a memory clinic and not know where to go or what to do. That should never happen. Nobody getting a terminal diagnosis should ever feel that they are alone and that they have no support. Okay, so this is why the Dementia Care Hub exists, because we will support them and we will support their families to make sure they can live as well as they possibly can and try and reduce any avoidable distress. Just try and make life as easy as we possibly can. And we do that through our weekly groups. Now, these weekly groups are based in evidence. They're not tea and sympathy. There is a method behind it. So we have a social group weekly. So this is to reduce isolation and loneliness. We have the We Care Dementia Care Programme, which is a therapeutic programme which looks at the changes that are needed in order to adjust to living with somebody who has a dementia, the changes in relationship, the changes in behaviour, all of those different things, okay? The thoughts and feelings that show up for people who are care partners of people living with dementia can be incredibly tough. So it's looking at how we manage those. We run wellbeing groups. So this is where people living with dementia can come and spend time with us. We engage in meaningful activities. And when I say meaningful, we hear that word banded around quite a lot, but these are things that are in line with their identity. They're things that make them feel good, living their life the way that they want to, doing the things they want to. So this also provides care partners with a block of time each week where they can just go and take a break, and whether that's read a book, whether it's have a bath, whether it's go to sleep, whether it is meet up with friends, whatever that looks like, it gives them the opportunity to do that, because care partners are at a huge risk in terms of their health. They have poor health outcomes. We have the research that shows that carer burden, carer stress, anxiety, depression. Okay, so what we're trying to do is reduce and remove that. We also run art classes, because when I conducted some research into art and dementia, what I found was that whether somebody had painted or not before, whether they had any real expertise in it, when they were engaging in the art group, what we saw were emotions such as pride, happiness, connection, joy, all these really great emotions. And what care partners reported on was that actually those positive emotions lasted about 2 hours after the group had finished. So this was a really positive thing to do. But what we also did is, running alongside that, we have a carer group so that carers can talk to each other without the person living with dementia sat next to them, which is typically what happens at the social group. So we're trying to cover the whole spectrum of psychological support. So come together separately, have training, and also that increased level of well-being. We can't change the trajectory of dementia. And equally, you may hear lots of things in the news about these new wonder drugs and these, this amazing stuff that's happening. Yes, there is a lot of work going into trying to find a cure, but the 900,000 people that are currently living with dementia, it is not going to make a difference for those. We can't reverse the damage that has been done. Dementia is a terminal condition. Okay, it's damage of the brain. The brain is decaying. It's not just about memory loss. And dementia covers Alzheimer's disease, vascular dementia, all the different types of dementia. Okay, Lewy bodies. There are about 9, I think, different types of dementia. So dementia covers all of those, and there are the different syndromes that lay within that. Alzheimer's disease is the most common. Okay, and I think that's probably why everybody thinks it's about memory loss, because that is typically short-term memory loss. However, dementia is not a normal part of aging. It is damage that's being done to the brain that is irreversible. So it's great that people are looking for the cure, and we welcome that cure. But currently we have a huge amount of people that are living with dementia now who we need to support. It's a local, community-focused charity. Okay, so when we talk about community focused, it's local people helping local people, whether people are employed by us or whether that is volunteers. All our members are local. So we are going to continue to do what we do and hopefully grow our service as much as we can and support as many people as we can. And we hope that you'll support us. Thank you.